It is all good. It's all good. So welcome everybody. I was just doing a little bit of a reminder. And I know we had like crazy technical difficulties when we were supposed to do this in April. So I'm so
Exactly.
ecstatic that we were able to get this to work. But I introduced this series, the Love Below series. And I've been interviewing people with whom I interact and I share
Uh-huh.
patients, clients, the like, right? Um,
hmm
because there's everything happens in isolation. And people say, I got this problem, I got this problem, I got this problem, and they never really connect the dots until we have these conversations. Um,
Correct.
so we'll dive into the love below, but just want to introduce everybody. I'm Dr. Erin King-Mullins. I am a double board certified general and colorectal surgeon, and I am here live with Dr. Lissa Bootstaylor, who is like um, such a mentor to me and such a trailblazer. And y'all know her online as the Body Snatcher, but she's so much more than that. The first African American woman board certified in plastic surgery in the state of Georgia. And where else? Because I know you've been certified in
All the
other
all the bordering states.
all the bordering states. So the Southeast,
Yes,
okay?
Southeast.
So
Yes.
when we talk about the queen, we have the queen here tonight. So and but such a special person as far as, being a mentor to me as a surgeon, a mom, and a wife. So thank you so much for giving me these
I
few
give
minutes in
you all
our
the love.
audience.
I give you all the love and
Yeah.
all the women out there trying as professionals trying to make it from day to
Yes,
day.
ma'am. Yes, ma'am. So tell us, just introduce yourself a little bit and tell us a little bit about your practice and your why.
Okay. Well, Dr. Lissa Bootstaylor, the name The Body Snatcher, my clients gave that to me. They just said, you're Dr. Lissa, you're the Body Snatcher. That should be your online name. I've been in practice for 27 years, which is crazy because it's been just very fulfilling. I do, at that time, reconstructive surgery, and then I evolved into just doing aesthetic surgery, but I trained at the birthplace of plastic surgery, the first African American female to get through that program that was started in 1932. I
Wow.
got through the program in 1996. So it took a while,
Yeah.
got through. And now I pretty much focus on body contouring, breast surgery, face surgery. However, since I trained at the birthplace of plastic surgery, I feel very well versed and trained to talk about almost anything. And then I'm somewhat of a dinosaur because back in the day, plastic surgeons had to do 5 years of 5 years of general surgery, then 2 years of plastic surgery, and then a year or two of research or an aesthetic fellowship. So I did all of that.
Wow.
So I really
Wow.
think of myself as kind of like the OG.
Yeah, you are the
Uh,
OG.
yeah, I'm never really scared of anything. And so I am so excited to be here with you today to talk about the love below, because
Yes.
there are so many issues that I think clients and patients don't feel comfortable with. And as moms, professional women, and women who want to live a long time, we have to say it,
Yeah.
speak its name,
Yep.
claim it, understand it. And then when we understand it, we become better providers for our families and for ourselves.
Yes.
So, congratulations to you for starting this series, because I think it's important, just girls, women getting together,
Yeah.
talking about some kind of uncomfortable subjects, but all in all, it's our bodies.
Yes, yes, yes. Thank you so much. And we do share a little bit in common. I can't remember if I ever disclosed this to you before, but I actually, so to be a colorectal surgeon, you do have to do the 5 years of general surgery and then subsequently do an extra year of training fellowship for colorectal. But
Mhm.
when I finished my general surgery residency program in 2013, I was the first African American woman to finish my program.
Kudos, kudos. There
Crazy,
you go. Right.
crazy.
Yes.
So history is still happening, y'all. History is still
Yeah,
happening.
that's right. It's still happening.
Yeah.
Absolutely.
Thank,
Congratulations.
thank you, thank you. So, yeah. So my name, Dr. Tushy Touch Up, right? And so the Tushy Touch Up procedure. And how I came up with that is I found that over the years, I remove hemorrhoids in addition to a lot of other things, but Patients would come, rectal pain, bleeding, burning, itching, all of these things. I'd see them and examine them like, oh, you have tags, oh, you have hemorrhoids, you have a rectocele scar from a prior surgery or whatever. Like, I can fix that, right? So I'd do the surgery. And then on the follow-up visits, and once everything was completely healed, every once in a while I'd hear, it's not quite how I thought it would be, right? It's not flat, it's not smooth, it's not this. I thought it would look a little different. I thought it would look a
Right,
little bit better. And so
right,
while I was solving the problem that was being diagnosed, the hemorrhoids or the tags, I wasn't solving the problem that the additional problems they were experiencing, whether it be just feeling uncomfortable in the aesthetic appearance of the area, completely flattening things out so they could clean better after bowel movements. So there's the functional results, and then there's all the everything else that comes with it. And so that's how the tushy touch-up procedure kind of evolved, by listening truly to what patients wanted at the end, not just having the hemorrhoids gone. So tell me a little bit about how your experience as doing all the things, plastic and reconstructive surgeon, and to kind of really getting into the body contouring and the aesthetics and really like honing in on what your clients and patients want.
right. Yeah. So I think that's a very good point. I think when a patient comes in and talks to a doctor, it's very important for the doctors to listen with that third ear. So some of
Yep.
you guys will understand that third ear. Just giving reference to another OG of the past, a civil rights person from the
Joe
past.
Madison. I
Yeah,
know
Joe
Joe
Madison, right?
Madison.
You
I
know him,
know
great,
him. I
perfect.
know
So
exactly who you're
listening with
talking
that third
about.
ear. And I think it's very important when a client comes in or a patient comes in, they're seeking information. So that's your opportunity to educate them, make sure that even if I'm not the appropriate doctor for them, they understand what tools you've given them so that they're able to be very strategic when they're talking to their doctor. Because some people
Yes.
are not comfortable with all doctors. They don't look like us. They may
Yep.
be a male. They may just make you feel uncomfortable. But if you have your list of questions and you understand like the issues, you can get some real good information and then make those healthcare decisions. But for me, it's expectations.
Yep.
So when a client comes in, a patient comes in, and they're like, I want X, I'm thinking in my mind, like, why now? Right?
Yep.
Because I want to make sure they can heal and be up and about soon. And then I'm thinking about their family. Like, what are the stressors that's bringing a person to me? Are there stressors that are internal or are they external? And
Right.
as a plastic surgeon, if they come in as a family, that's nice because I know they have a family unit and they have support. If they come in alone, and they're talking about their husband or their boyfriend or a lack of a boyfriend, then usually most experienced people will kind of talk about that. Is it for
Right.
you? Is it for them?
Right.
Um, and even though sometimes we're really good at executing the procedure, we're not mechanics. Good doctors understand they're more than a mechanic because you
Yes.
can have, you can hit a home run, but someone just doesn't feel right. It's how
Yes.
someone feels when they leave you. Even if it's like okay, and you tell them that they can have problems and complications, and I'm sure you're like me, we're OCD, we want to go through all the possible problems, blood clots,
Yep.
emboli, you may die, but all this stuff. You talk about it, and then if they end up in the ICU, you've already educated them,
Yep.
right, about why we're in the ICU, and then they understand and trust that you're going to get them to the other side.
Yeah.
So even though when patients do like a surgery, like a hemorrhoid surgery,
Hmm.
now to me a hemorrhoid surgery is like a paper cut in a very unpleasant place that can
A
get
little
out of
bit more than a
control.
paper cut. It's
Well, I
it's a
mean
little bit more
like,
than a paper cut. Yeah,
but
I
you know
know.
how, but I mean like it escalates, it
Oh yeah.
escalates, right?
Mm-hmm.
And unfortunately, when you're pregnant, you can have hemorrhoids. That's just
Yep.
a natural process. And some people become a little bit like somewhat of a perfectionist. They want it perfect down there.
Hmm. Yeah.
But with it being perfect, to get to perfection, it's almost impossible.
Yes.
And there was a question that you had asked me before. You said, "What are things that you see as a plastic surgeon that you just kind of look over?"
Hmm.
So one thing I look over is everyone is asymmetric. If you have two eyes, you look at Brad Pitt, you look at me a long time, one eye is open more than the other, one eye is slanted. So if you have a perfect ring, like around, around the anus, you have that nice little pucker before you get pregnant. Everything's so neat and tidy down there.
Yep.
I
Yep.
mean, like everything is like puffy. Um, you can get wax and it's just perfect, just like the books. And then you have a baby and you look down there and you're like, who is this? There are
Right.
tags down there.
Yep.
My girlfriend looks lopsided. One side is bigger than the other. Everything used to be nice and tight. Now things are
Yep.
loose. And these are things that if, OBGYN doctors could talk to their patients about it, that would be great. But you and I,
Right.
seeing patients after they have reared children, I know that they've taken a hit.
Yeah.
So
Yeah.
I tell them, look, everybody feels this way. Everybody, you've been in battle, girl. You've been
Right.
in
Well, it's been a
you've been at
battlefield.
war,
Yep.
right?
And
You just have to meet their expectations, understand their expectations, let them know there are limitations, real limitations.
yep.
And I think another thing I like to tell clients and my patients is that, I want to under promise, but I want to
Yeah.
over deliver.
Yes.
But I want you
Yes.
to know I'm under promising, but I'm hoping to over deliver.
Yep.
And now they kind of understand, like, I'm in the game with her. Like,
Yeah.
I,
Yep.
I need this
Right.
procedure. I
Yes,
need to
there's an
have
investment on both sides,
on both
because we're
sides.
investing in our relationship. We're investing our reputation, and not that it's like, the Mean Girls Club or anything like that, but it's like, our livelihoods rest upon our reputation and the quality that we deliver. And so that's extremely important. And so if I know I can't send you to the moon, my name ain't Elon Musk or whoever else is doing it these days. So,
Mhm.
I know if I can't do that, I'm on aim for it, but I'm going to let you know that it is going to fall short of the moon, right? But we may land on a shooting star, which is also a wonderment, right? And so let's kind of level those expectations.
Yeah.
Um,
Yeah, I
and
think a good surgeon knows their limitations.
yeah,
And I think there are times when patients come to me and they're like, okay, I want X, Y, Z. They've executed the whole protocol,
yep,
and I need you to do this. I want these size implants. This will look good. I'm going to be super flat. I want to bounce a quarter off my abdomen. I want etching. And then I'm just like, wow, is there anything? Can I add something to the plan?
right. It's
Can
like
I
that
add
birthing
something?
plan. Remember that?
Yeah,
Like
can
when we
I
go on
add
that
something
birthing
to the
plan, we're like,
plan?
right,
And I think people have to understand it's a partnership,
yeah,
basically. And
yeah,
if I can't do it, and I'm sure you tell patients sometimes,
yeah,
like, I can't meet your expectation.
yeah,
And it's not that you're turning them away. You just understand perhaps they need to see someone else
right.
to really make an informed decision.
Yeah, yeah, that second
And
opinion. Yep, that second
that
opinion.
second
Like, I
opinion.
need you to. I'm like,
Exactly.
someone else may have a better grip or a handle on what you are desiring, and so I implore you to, hey, just shop around a little bit. You may come
Correct.
back, you may not, but I really don't think my recommendation will change based upon whatever someone else says. I'm not asking you to get a second opinion so that I can decide I'm going to do what they said. I want you to get a second opinion so you can decide which direction you're going to go in. Yep.
Correct.
Yep.
Correct. Yeah.
And you know what I tell patients? First and foremost, because most times by the time someone gets to me, they've been suffering for a minute, right?
Yeah.
So they've been battling with it in silence for so long. They've been, secretly Googling and searching, and maybe they've been on social media and this and that, and they've kind of gone for some consultations. And a lot of times when they go on consultations, those first few visits, they may not be fully forthright with whatever physician that they're seeing because they're still, timid and ashamed and embarrassed. And so by the time they get to me, I tell them, they're explaining away. They're making not excuses, but they're trying to, like, you know, convince me. And I tell them first and foremost, the reason to do this is because you want to. First and foremost.
Correct.
Now, outside of that, we have to then decide if you're a candidate for it, which is a slightly different thing. So now we dive into your symptoms, your why, right? Like you said, if a family member is involved, a lot of times I'll see patients who, they may be seeking a new relationship. They're divorced or separated from a long-standing partner. They've had children or had trauma, and so they've lived through that trauma and what it looks like now together. But now we're trying to start a new relationship, and we're embarrassed about of intimacy and all of those types of things. And so we have to, number one, just say, hey, first and foremost, it's okay to get it if you want it. That's the only reason you need to get it, but let's talk about if you're a candidate for it and how we can achieve, your goals. What are your kind of other conversations like after just like, hey, okay, you want this, um, now this is what we expect or anticipate.
Yeah, I mean, after that, then we get them kind of pre-op for surgery. Now, because I think of myself as a wellness doctor in some ways, so obviously I'm a mechanic and I can execute like crazy in the OR. But I really want to get them in the mindset of that is one, an investment. Anytime I cut people for a living. We cut people for a living, right?
Right.
So this is serious, right?
Right.
We can laugh
Yes.
all we want, but that's how we make our living. So that if you're going to go under the knife, what type of lifestyle changes are you going to make to minimize a return to the OR,
Yep.
right? To
Yep.
tinker with the problem that you're taking to the OR. And I think everyone has to understand every time there is a scar placed on your body, the scar is a monumental act of healing. Thank
Yes.
God, thank God you healed, right?
Right.
But then we are like, well, I want it to go away. Well, a scar never goes away. It just
Correct.
becomes less obvious. So if
Right.
you know you're going to have your body have a lifetime scar, let's talk about like protecting the investment. So we go over all the pre-op things, but because I'm on your show, we're talking about, love from below.
Sure.
I have a very, very uncomfortable conversation about like, all right, here's your shopping list. And I know you're going to have a flat tummy and everything's going to work out, but the narcotics back you up. They're like, yeah, 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 I know,
Right.
I know, I know. I said, but it's always weird because like day 5 or 7, when you haven't pooped, it's a new experience. It's quite unpleasant. So
Yes.
these are the things. Yeah, I got my Colace. I got my local magnesia. I got this, and I said, okay, great. So let's go organic. Let's
Right.
talk about some things that
Mm-hmm.
natural things you can use because this is our time to educate patients,
Yep.
right?
Yep.
And everyone's trying to go elemental. That's what I tell patients. Organic is such a weird term now. I think people have kind of like, you know, um, it's not true to its nature.
Right. Yep. Yep.
Right.
Yep.
So
Yep.
you try to go elemental. So I talk about things that will basically soften their stool. And it's so crazy. But, I talk about things like prunes that mom talks about. Why is
Mm-hmm.
that? It brings a lot of fluid into your colon. I tell them that, flaxseed. So they know about the flaxseed. They know about chia seeds, and chia seeds are kind of popular. So
Mm-hmm.
these are things they need to know. And
Yep.
chia seeds are very high in omega 3. Then we go on and talk about magnesium rich foods. So, what are
Yes.
magnesium rich foods? Well, I like to talk about that because one, post surgery, there's a lot of fluid that washes out of their body, so they get cramps. And
Yep.
so, this is something that could offset that. And then, something that's very high in magnesium is avocado. So, avocados
Yep.
are a good fat. And so, they're learning these things.
Yep.
You want to have cashews, you want to have spinach. And I believe these are like long standing little seeds that you plant. Like
Yeah.
you're doing it to be pretty, but you're learning these healthy habits.
Mm-hmm.
Why are they healthy habits? Well, they're elemental. There's no
Yeah.
preservatives in them, right?
Right.
There's no additives in them. You know that when you
Yep.
have an avocado, it's just an avocado,
Avocado. Yep.
right?
Yeah.
And you're going
Sprinkle
to
your
get,
little everything bagel seasoning on top, and then you're good. Give it a little
exactly,
crunch.
yes.
Give it a little.
Yeah, and it's low in
Yeah.
carbs, right? So
Yep.
now we're talking about managing your weight, managing your diet, what you put in, and then we talk about, fiber, like what's good fiber, what's bad
Yep.
fiber, what's
Yep.
roughage, right?
Yes.
So, I'm like, okay, roughish, things that are kind of rough. You want oats. Okay, you want
I'm
fiber
gonna send.
bread.
I'm. I'm gonna start sending my patients to you instead of bringing on this nutritionist that we got on. No,
No,
I'm just
but
kidding.
just
But it's
making
so
sense,
important. Yeah.
right? Because this is
Yep.
your time for them to kind of really, they're listening to you. They want what you have. They don't want their bottom to hurt, so they got their full attention.
Yep.
They want to look a certain way, so have their full attention. And I think that's just something I do. So we talk about that. And then we talk about the post op course, like what are the changes that are going to happen after surgery. So I'm really big on it and very protocol driven in my office. I believe if you have a lot of information, you're going to
Yes.
really do well. And
Yes.
I encourage them to text us, to communicate with us, to agree that they're going to keep their post op visits. And I'm sure
Yes.
you have that. Some patients
Yeah.
don't keep their post op visits.
Yep.
And the problem is, and there's a healing process,
Mm-hmm.
and the door eventually kind of closes, or we're unable to manipulate or reverse or improve the
Right.
surgical outcome.
Yep.
And so,
Yep.
the first 3 months, we need to really be involved with our healthcare, making sure that everything's healing. And
Yes.
I talk about scarring because scarring is very important to a plastic surgeon because we don't want someone to be scar burdened when they leave us.
Right.
So if someone has a history of, keloid scarring, then, I'm going to do a deep dive into who in the family has keloids. I'm going to look
Yes.
at the areas which are high risk for keloids. And you know this, it's the breastplate, it's the ears, right? These
Yep.
are the areas that are very high likelihood. And then also if they have problems in those areas, you know that they're at high risk for other areas. Then
Yep.
I talk to them about like post-surgical management of keloids or hypertrophic scars, educating them that, a scar has a continuum. After surgery, we just
Yeah.
close the incision, right?
Right.
But
But
then
your
the
body's got to
body,
heal after
right,
that.
the body has to heal and it
Yep.
goes through a phase. So for about a month, it's kind of fragile. Like things can happen that can open up a scar.
Yeah.
So you can support it by taking, zinc, there are medications you can take, vitamins you can take. But they need to know they have to support it. And within 3 months, for most African Americans, a scar will show you who it
Yep.
is.
What it's gonna be. Yep.
Right.
So we had a couple of people join in, so I'm just going to say hey and welcome to everyone who just joined in watching us live. Dr. Erin King-Mullins, Dr. Sushi Touch Up, on live with Dr. Lissa Bootstaylor, the Body Snatcher, pioneer in plastic surgery here. And we're just having these conversations, the love below, and really the purpose of tonight, because we've had so many different conversations about the love below when we talk about, we've had pelvic floor therapists, nutritionists, we've had GI docs, menopause care physicians, but we're just talking about agency, right? Like women, whomever, taking agency of their bodies. And if there's something that they're not satisfied with, that they have the opportunity to at least explore what their options are to address that. We may not be able to fix it. We may be able to fix it. We may be able to make what they consider perfection. We may not be able to reach that, but ultimately we want to achieve an improved, kind of quality of life. um and in the first step is, like you said, just having those conversations. And I think you and I have become attuned over time to really drawing out certain answers based upon their body language, their feedback, how they answer a question. And plus also, they don't always know the terminology. you know
True. True.
um, One of the biggest examples that I get, and then we have a question in the chat I'll uh, pose to you. For example, a patient may come in and they say, I have constipation. And so everybody has their own definition of constipation. There's a
Right.
textbook definition,
Mm-hmm.
but there's a range of normal. And so, and especially me as a colorectal surgeon in dealing with the pelvic floor, I have to isolate, number one, do you have an issue with the urge to have a bowel movement, meaning like you just don't get the signal to go? Or are you defining constipation as you can't get it out? It's sitting down there, you feel it in your rectum, and now you just feel like you literally can't evacuate. And so those are the type of questions when we have to kind of probe a little bit more when a patient may present complaining of something or they're desiring something. You really kind of got to get in tune with
So,
what
so
are
what
they
does that
actually
mean? Just
seeking.
Just for me, what does that
Yeah.
mean? So they can't get it out or they don't get the desire. What does that mean? What are those two different things
So,
mean to you?
so maybe their bowels are sluggish, they're moving, so they're dehydrated, so the
Mhm.
colon or the intestine isn't moving the waste forward as quickly as it should. So they just aren't getting that signal, to go, as frequently as they should. Or when it's down there, now they can't get it out. So that may imply a pelvic floor dysfunction. So dysfunction of the levator muscles or the sphincter muscles. It could
Mhm.
be a rectocele, or what we call is the beginnings of like a rectal prolapse. And so
So
their
they
pelvic
can't
floor
push it
is
out, basically. It's there, but
correct,
they can't
correct.
push it out. Gotcha.
Exactly, exactly.
Gotcha.
So those are the things that, that I kind of try to, isolate and make sure that we're talking about. Or some people are like, I have diarrhea. I'm like, okay, does diarrhea mean, so how many times are you going to the bathroom a day? Twice. I'm like, so in most people's minds, oh, that's not diarrhea, but they're just talking about my stools are really, really liquidy. So that's their definition of diarrhea. So we
Hmm.
have to make sure that we are, kind of, or I have to make sure that I'm actually like probing and trying to figure out like, what exactly are you trying to convey to me? What exactly do you want fixed? And so
I,
that's kind of like how that, yeah.
I get what you're saying. I think a lot of times, even with like GI habits or your bowel movements, or
Hmm.
even with a complaint about how you look, some people say, well, that's cosmetic. But
Yeah,
I would say to them, if you're thinking about every day and it makes you uncomfortable, then you need to seek out someone who could help you work through that issue. So
right.
it's very interesting because I know I wouldn't think like if someone has diarrhea, do they need to see a specialist? But if maybe they're soiling themselves periodically,
Yeah,
right? It's something. It's not normal. They're young. They shouldn't be doing it.
right.
But sometimes people, I think, delay seeking medical attention because they're embarrassed. And I
Yeah.
think I'm so happy that we're having this conversation because it's important. Now we do have Dr. Google that can help you. But I will say this about TikTok and social media. I do think it's a great way to start the conversation
It
because
is.
I
It
think the
is.
conversation was just not, it was being said in multiple little bubbles or little
Yep.
islands, silos.
Yep.
But,
And
but I'm going to say it's not the place to finish the conversation.
exactly,
That's the
exactly.
important part.
And that can be extrapolated even now when we talk about, AI and healthcare, and obviously that can be a whole different conversation.
Hmm.
But sometimes people don't really know what they're asking, or they don't have the terminology correctly. So, and forgive my French, but this is what I say about like the different AI prompts and all that stuff. And I can say this as a colorectal surgeon. If you put shit in, you'll get shit out, right? And so
Yes, yes,
literally.
yes.
So if you're
Gotcha.
not putting the right information in, because again,
Hmm.
a patient comes to see me for hemorrhoids, everything that happens down there, they call a hemorrhoid, right? So anything,
Right.
pain, bleeding, burning,
Yes,
itching, they're like,
yes.
oh, I got a hemorrhoid. You and I know as surgeons, there can be fissures, fistulas, abscesses, cancer. And so if someone is going to Dr. Google and say, how do you treat a hemorrhoid? Oh yeah, they're going to get a long line of ways to treat that. But if it really isn't a hemorrhoid, that's not going to help them. And so that's why, it's great to start those conversations so you can actually explore and kind of get a little bit of background knowledge and
Hmm.
information. But we tell you, like, please seek medical attention because if
Correct.
you
We shouldn't
don't really
finish the
know what you're
conversation
referring,
there. Yeah,
yeah,
it's just it's something you may do just to get an overview of your symptoms, but
hmm,
you need someone who one will make sure it's not something bad, right? Because
yeah,
bad things happen when you're young, and bad things happen when you're older. And then there it is such a thing such as you get one hem where you think it's gone, but now you got a skin tag,
yep,
and now you're not moving your bowels correctly. You're constipated. So you're going to get another hemorrhoid, and
yep,
maybe soon it'll become strangulated. And I haven't done colorectal surgery in so long, but I'm telling you, I have vivid memories of people with like strangulated hemorrhoids, big strapping men like, doctor, help me. And I'm
yeah,
like, that is so painful. And they
yeah,
don't realize that it's a slippery slope,
yep,
that is
yep,
going the wrong direction. Where if you go to a physician and they're like, okay, yes, the online treatment for this worked out for you this time. However, let's look at your diet.
right,
Let's look at these other things. Let me look at that
right,
little ring down there and see how it looks. Oh, you have had multiple episodes of hemorrhoids. You have lots of tags.
yep, yep.
So
So,
it's about being proactive,
yeah,
basically. You can use Dr. Google, but you have to go beyond being proactive. You have to follow up because it
Yes.
is your body. You only get one temple.
You only get one. You only get one. So it looks like we have a question that came through for you. All right. So it says, I lost a lot of weight and now I'm noticing loose skin everywhere, including my butt and private areas. Who should I see first to figure out what can actually be corrected?
Yeah, what a question. Yeah. So yeah, that was one of my one of the items I did want to bring up because we with GLP-1, what's happened is that people have undergone rapid weight loss. And we
Yep.
can talk a little bit about like childbearing because I just want to kind of walk people through what happens during
Yeah.
childbearing to each body part so they'll know like the time period to seek medical help. But when you lose a lot of weight, first thing we have to make sure is that the weight loss is stable, right? Because we
Yes.
don't want to do any surgery, go for consults, and your weight is not stable. So once your weight has been stable, really the textbooks say about 18 months. Now that may be a long time, but a lot of people have to come on and off their GLP-1, right?
Mm-hmm.
If you've had any kind of like manipulative gastric bypass surgery, sleeve or something, right? You have to come to a new equilibrated baseline. But at
Right.
least a year, like, okay, everything's stable. I'm not going up by 20 pounds or so. I'm eating right. My albumin is good. I'm eating a healthy diet. You have to be able to heal your incisions once you have
Yes.
surgery, right? So you can't
Yes.
come in like a pit stop. You have to come in
Right.
really nutritionally sound as
Yes.
possible so that you can have the surgery and then recover uneventfully without any wound healing problems. So I think when patients lose a lot of weight, they have hygiene issues. They have rashes that could be a problem.
Mm-hmm.
Intimacy can be a problem. So these are real issues. And this is where, is it cosmetic surgery or is it functional surgery, functional
Yes.
recovery, right? So a lot of times this is the gray area that's occurring with people who've lost weight because they've lost such a massive amount of weight. They have rashes, they have infections sometimes.
Yep.
There are times even when the whole mons pubis, which is like the roof of the vagina, falls down. I've seen that, and when they urinate, it goes shoots out somewhere else.
Yeah.
But unfortunately, these days, insurance companies just kind of tell you to wear certain things, and it isn't covered. But I would submit to people that you need to decide what's the most important area that you want to address first.
Yeah.
What's the thing that when you look in the mirror, you're just like, this is the thing that has to go?
Yeah. Yeah.
Because that's going to make you very satisfied on the other end,
Yep.
regardless of what happens, right?
Yep.
Pick the thing. That's the number one thing. I
Pick
want
the
to
one.
be able to wear my pants and not have a big pooch in front of me. I want that
Yeah.
to be gone.
I know it's like I sometimes go in the room to talk with a patient after my medical assistant has done the intake and they write a message to me, kind of, initial blurb of why they here or whatever. And, you'll see 10 complaints on there. And, so I'll walk in and I say, hey, I got a reporting of, why you're here today. Let's just start out saying, like, if there's one or two things that I could fix or change and you would be like totally happy, what would that be? Right.
Right.
And so those are things that we have to talk about because it's easy to kind of bring all your problems to bear, but not everything is necessarily correctable, but also not everything is guaranteed to have the outcome you expect. And so the question is, would you rather go through the process with a 50-50 shot, or would you really focus on something that you know is really going to kind of get you where you need to go? So I think those are kind of really important conversations to have.
Yeah.
Um,
So,
and you and you hit the nail on the head real quick just about nutrition, right? Because people, they are building blocks in our body. And so when you're losing weight, your body's metabolism is focused on shedding, right? It's kind of throwing off pounds. And also with the GLP-1s and the different medications that are going on, a lot of If you're not eating the right diet and maintaining the right level of activity, you're actually, a lot of the patients are losing quite a bit of muscle mass. And your
Correct.
muscle mass is what's going to give you your contour. That's what's perking up your cheeks and those cheeks down there too. But that's what's keeping everything whole. And so when we're losing a lot of muscle mass, your body is not in an appropriate state to build and heal from surgery. And so those are kind of important points to make with patients
Yeah.
because, yeah, while you slim and trim, and that doesn't necessarily mean that you're going to
Right.
heal. Yeah.
And you know this as a surgeon, we call that negative nitrogen balance.
Yep.
So nitrogen is an element that is part of protein,
Yep.
basically. And when you have to rebuild your building blocks, which is the scar, like
Right.
doctor makes that incision and goes down through the tissues. They're basically going from level 1 all the way down to level 10. They take something out, not everything from level 10 all the way up to level 1 has to heal.
Yep.
And it needs the right proteins, it needs the right amino acids there in
Hmm.
order to repair level 10 all the way to level 1. And not to mention, this is a moving system
Hmm.
because you're getting up, moving around. So we call that negative nitrogen balance. So that means if you're on GLP-1 and you're protein deficient because you're losing your native muscle, it's
Yep.
probably negative nitrogen balance to the
To the
second degree.
extreme. Yep.
So
Yep.
really making sure that you're eating properly. The doctors will do an albumin. There are other tests that we could do that are more specific. Generally looking at you, we can tell, and then also the biochemistry or the biochemical labs that we can get. That'll help.
Yeah.
But I also want to say that when patients are trying to decide if they want to have exercise, and you may feel this way, I feel that when patients work out, they recover
Yeah.
faster.
They do. They do.
They
Because their bottom
recover
is,
faster. It's
yeah.
something about maybe that muscle memory for soreness
Yeah.
or just able to get out of bed
That
even though things are
metabolism.
aching. Yeah.
It's training like for a marathon. So, one of the things, especially in the age of, I do a lot of robotic surgery, minimally invasive surgery. And so
Mm-hmm.
we're talking about, so moving away from real briefly, just from like the love below and hemorrhoids and stuff, when I'm doing like colon resections for colon cancer, Crohn's disease, ulcerative colitis, all of these things, I'm losing these little itty bitty incisions, right? The biggest incision is usually about this big, where I actually have to remove the colon. Um, these are surgeries that back in the day, you got cut from stem to
Oh
sternum.
yeah, yeah,
Okay.
yeah. From
And
your
so,
breastplate down to the girlfriend. Yes,
yes, yes.
yeah,
And so when you have that big incision, it's so easy for people to be like, oh, yeah, I got to take it easy. I got to do this. Yeah, look, they're wearing their wounds on the outside. Now we have the capability to make smaller incisions. But I tell people all the time, I'm like, the surgery that happened on the inside is the exact same. The only thing that's different is the little incisions on the outside. But your body has run a marathon
right,
in this surgery, and your body is running a marathon every day for several months trying to heal internally, like this new anatomy. We've taken a whole portion of your intestine, removed it, rerouted it, reconnected it, and everything has to grow in together. Every little cut and stitch and your body has to heal that from excessive bleeding, and then kind of recover from that. And so that's why I
it's
tell people, I'm
it's
like,
like invisible trauma.
yeah,
Like
like
it's
little
like
incision
one
on the
trauma.
outside,
Mm-hmm.
little incision on the outside, big surgery on the inside. So I tell,
Right,
so that's what we're kind of telling people. And I know even in the plastic reconstructive space, when a lot of things have switched over kind of to the nipple sparing mastectomy or the shadow, incisions kind of on the lower portion of the breast and things like that. Like people, they see the small incisions and they think, oh, it's so dainty and whatever. And it's like, no, no, no. You still got to heal. And all those layers, just like you said, from level 10 to level 1, got to get in
right.
formation and kind of get back together.
And I think
Um,
the other thing I think patients don't understand is that the body has been assaulted, right?
yep.
So what your body does is it weeps. So
Hmm.
you lose a lot of fluid, and then that fluid is a lot of protein. So once again, you're in negative nitrogen balance. You at a real deficit. And
Yes.
that deficit is exhaustion. The
Yep.
deficit is poor healing. The
Yep.
deficit is lack of energy. So even though you may not have the big scars from the past, we're
Right.
just as effective through small incisions. So you still
Yep.
have to give yourself grace, and you got to get in it and be willing to win it. Like I gotta
Yep.
eat, I gotta get up and walk around, I gotta poop on time. I mean, it's like chop chop lollipop. I'm like, let's go, let's go, let's go.
Yeah. All right, we got a couple more questions. Let's see. 'Cause I think we only got a few minutes left, so we're gonna get to all your questions. Welcome to the
Mhm.
Love Below, everybody, with Dr. Lissa, I was listen. Oh Lord, I was about to call you the booty snatcher. That's probably me. Anyway, um, okay. How do I know if what I'm seeing around my anus is actually a hemorrhoid, a skin tag, a scar tissue, or just normal anatomy? Well, first you come see me. Um, but seriously, you should be evaluated because the biggest thing is even though you may be concerned about a hemorrhoid attack or something else, there really can be other things going on. And I see patients all the time who have been treated for hemorrhoids with with the creams, potions, lotions, suppositories, based upon just what they're reporting, and no uh, doctor, APP provider, nurse, no one's ever looked. And then fast forward, they're like, "Oh, it keeps growing," and they come see me, and it's a cancer.
Mm,
So
mm.
I'm not here to freak anyone out. It's kind of trust but verify. So please seek medical attention. That's how you know what you have, and that's how you can be empowered to make whatever decision. If we decide it's just hemorrhoids and you can live with it, then that's totally fine. But it can be something else that can be very, very detrimental later.
Yeah, I also want to say that sometimes patients think like it's going to cost a lot to see someone like you or someone like me. But you and I know our best friend is our primary care doctor,
Yes.
because the
Yes.
primary care doctor is going to examine and address all of your concerns. So I would encourage everyone, before you go to your doctor, just take a minute, write everything down. Once you have everything, because a primary care doctor may see like 40 patients a day. So if
Yep.
you forget, or even perhaps don't even finish your sentence, they could be out the door. But if you
Yep.
show them your list, a lot of them will say, "Okay,
Right.
give me your list," and they're going to hit
Yes.
all the highlights and they're going to check everything. So you want to make sure you're efficient when you see a primary care doctor, because they will send you to a specialist, like
Yep.
Dr. King or myself, because they know we'll address it appropriately and you'll have a referral that's appropriate. It's not just
Exactly.
you picking a doctor, out of a book and seeing the doctor, and then it's the wrong doctor.
Right. Right. Let's see, we got another question. Oh, this is awesome. This is sweet. We have a health science student at Spelman, boop, boop, here locally. And she's asking if we accept student interns and shadowing. And she's so inspired by us seeing Black women such as us in the field. So um, I know I definitely do offer some shadowing opportunities. And so I would say the best way to reach out to kind of both of us and our teams so we can make sure that what we are discussing may be appropriate and in alignment would be maybe send a direct message. And so our teams can kind of collaborate and understand exactly what you're looking for and what we might be able to do.
That is
So,
true. That is true. Yeah.
yeah.
Although
So,
I will say the squeaky wheel gets the oil.
yes, yes.
Now,
Uh-huh.
that's true, because I've had people, basically introduce themselves to me, and then they send their resume, and then
Yep.
they are on social media.
Yep.
And, at least I help them. Even if they can't like be in my space, I can
Right.
definitely, I'm interested in, because they're so motivated.
Yeah.
I want to make sure they get plugged into someone.
Yep.
So, feel free to reach out. And, if we don't respond, especially if it's on social media, send a fax to the office. There's several
Yep.
ways to do it. You guys are very savvy, so I know you'll figure it out.
Yeah. And please, again, things get lost. If we're in the OR doing surgeries
Right.
that take several hours, we have to kind of triage things once we are available to understand, handle what's most serious first. And
Right.
so if you don't get a response that first time, it's not unreasonable to reach out again. It's not that we're purposely trying to ignore. It just may have gotten, kind of lost in the shuffle.
Mhm.
And it's so funny you say the squeaky wheel gets the grease. I'd say closed mouths don't get fed.
That is
Okay.
true. That
So,
is true.
so,
Yes, yes, yes.
oh, okay, we got a message, a reply to that. Please send them my way as well. The Women's Health Leadership Initiative is geared for pre-med students using women's health as a lens to learn about health disparities. So if you are watching, Miss Kennedy, so at official OFFI is or Offical. I don't know if it's missing an I, but um, at OFFICAL dot WHLI. And so that is, and you should be able to see other folks that are there making those
That's perfect.
comments in the chat as well. So
So, so I
thanks
have
for
a question
reaching
for
out.
you. Are
Yes,
there
ma'am.
more questions?
Let's see. That's all we got for now.
So
Go ahead.
just know, because you're a surgeon, I'm a surgeon. Like, how do you cut someone? Because people ask me, like, how do you cut
How do you
someone?
cut someone?
Like,
Yep.
right? Because other moms are pushing papers. Maybe in the
Mm-hmm.
courtroom,
Yep.
helping people. Like, what makes you like? I'm gonna just take someone's colon out, and I'm gonna put it
Right.
back together, and I'm gonna like, what happened?
Yeah, it's kind of one of those things that found me over time. My story is actually when I started in medical school, everybody was like, "Hey, what's your specialty gonna be?" And I'm like, I literally said, "I don't know what's gonna be, but I know I'm not gonna be a surgeon." And here I am. And so my mentor actually said, "Be careful what you say never." And here I am. And of all things, colorectal. Um, but colorectal, and people who know me probably know I have a little bit of ADD. I'm a little bit, have my hands and everything. But I think it is really, symbolic of my personality in the sense of we have conversations in the office. We do preventive care when we talk about diet and exercise, colonoscopies, colorectal cancer prevention, hemorrhoids, could be like some of the most satisfying things for people because now they can clean themselves and not have pain and bleeding every time they use the restroom and not have to know where every restroom is, to life saving procedures, large procedures when we're talking about the colon resections, and all of those things. And then if I have to give someone an ostomy, I have to be um, their therapist, their cheerleader, kind of all of those things. And so it's just kind of, I think, befitting of kind of just my personality because I can be, there's no one day is the same. And then I can be a little bit of a plastic surgeon with tushy
Of
touch up.
course. Exactly,
I'm
because
making it
that's
all,
I mean, a woman is a woman
making it
in
all
the
better.
end, so you're always
Yeah.
going to find like the aesthetic, no matter
Yeah.
what field you're in.
Yep.
But yeah, that's amazing. But I think like when a woman, as a female surgeon, when we cut people, we take it very, very seriously.
Yeah.
It's not an easy job, right? What is
Yep.
it? Heavy wears. What is it? Heavy is the weight of the crown. Like when you're
Yeah.
like the surgeon, everything
Yeah.
weighs on you. But
Yep.
I would say that I know you had excellent training, and that did it. The training
Thank you.
prepared you, right?
Yeah.
To really
Yep.
always step forward, always put your best foot forward, take all the knowledge that you've learned. And one thing I love about female plastic surgeons, we may be like soft on the inside, but
Hmm.
in the OR, we run a tight
Beast.
ship.
Mm-hmm. Mm-hmm.
We don't
Mm-hmm.
ride brooms, but yeah, people
Yeah.
know like okay, chop chop lollipop. Once again, things must
Yes.
be in
Yes.
order.
Yep. Always
So for
important.
all you women listening out there who want to be surgeons, um, it definitely chooses your
Yes.
personality, um, and I feel very blessed and fortunate to do what I do, and I know you feel the
Yes.
same because
Yeah.
you're I call us unicorns. We
Mm-hmm.
run around,
Yeah.
we're kind of like we're different, we're just
Yeah.
different.
Yeah.
But we're out there delivering healthcare to our patients. We love what we do, and colorectal surgery is serious. I have used Erin myself for my own healthcare concerns, so I fully endorse her. And I don't endorse
Thank you.
anyone. I
Thank
really
you.
don't because I like people who are about the business of medicine.
Yeah.
It's so important for African American women who are the captain of their ships
Yeah.
to really take care of themselves. Got to do it.
Oh. Oh, well, thank you. Thank you. That was so sweet. That was so sweet.
Yeah.
So if there's no more questions, we're gonna start, kind of wrapping up here, So again, the Love Below series, we just want to have these conversations to make sure that number one, you're not alone out there in whatever it may be. So we've talked to menopause specialists, pelvic floor therapists, GI docs, registered dietitians, fibroid endometriosis specialist. So we've had these conversations, so we could at least give you a springboard, a starting point. So maybe you started on Dr. Google one day and then tuned in to the Love Below, and now you're kind of getting an idea of where to go next, okay, to maybe get some solutions. Let's see. Yep, we're gonna get to the perfect right there. Where are we both practicing now? So again, So I'm a double board certified general and colorectal surgeon. My office is Colorectal Wellness Center. My office is in Fayetteville. You can see me colowellness.com. And then I'm on all the socials as Dr. Tushy Touchup. And so please feel free if any of the conversation tonight has sparked any questions or concerns, please feel free to reach out. We do have some private kind of basic intake forms that are available or appointment requests that are available just for you to gauge your interest and we can kind of get back with you. Dr. Lissa, tell us number one, how we can find you, and number two, what are some final parting words that you may have for those who are
Okay.
listening?
So drlissa.com, that's with two S's, DRLISSA.com. Then it's Dr. Lissa the Body Snatcher on Instagram, on TikTok, on Facebook, on YouTube. And my parting words is although I've been practicing for 27 years, I just believe in girl power, man. We can
Yeah.
just blow it out at any time. And I recently published a chapter in a book, Male Aesthetic Surgery. Who
Whoa,
knew?
how come I didn't know about that?
Yeah,
Yeah.
it just came out. Just came
Okay.
out.
Well,
So I have
congratulations.
a yeah, thank you, a book chapter on male aesthetic surgery. And like I'm a girl, but what do I know
Okay.
about a man? But men always put breast implants in women, so tit for tat. Look, I know
Right.
what a man wants, even though, and I
Right.
have a good male following. But I'm in Atlanta, in Midtown. I have an office that's opening in Buckhead, and I specialize in aesthetic surgery and more specifically, awake surgery. So, awake liposuction, awake body contouring. And I recently came back from Bangkok and delivered a lecture internationally about high BMI body contouring. And,
Awesome.
I put Atlanta on the map. So, I just wanted my parting words is that it ain't over till it's over. And you can always restart your story. And I never thought
Amen.
I'd be doing book publishing now and trying to write a paper and lecturing internationally. But that's who we are. Like I say, unicorns, man. We just have so much in us and we have to believe it. And then lastly, as a plastic surgeon, I got to say this, aging is inevitable, but suffering in silence is optional.
Amen.
All
Amen.
right.
Thank you so much, Dr. Lissa, Dr. The Body Snatcher. So stay
Thank you.
tuned for, we have some great upcoming Love Below. I don't know exactly which order we're going to go in, but I know we are going to talk about, right? We're going to have a farm to home.
Mm.
Okay, a way that you can get fresh, safe foods delivered to your home, especially in this day of all of these recalls that's going on. We
Right,
need to be
right.
safe.
Yeah.
And then we are going to be speaking with another GI that's specifically a gut health specialist. So we want to keep going with the love below, making sure that you are having your questions answered and that you feel comfortable and confident in your bodies and your bowels. Okay?
Thank you, Erin. Thank
No
you for
problem.
the
Thank you.
invitation.
All
Much
right, y'all.
continued success. All right, good
Bye
night.
for now.
Good night, all.